So we're live. Welcome everyone back to my channel. This is YORUBADE. I'm Tony A, your host. Uh, so I'm sure a lot of you all know what's going on in Ghana right now. You got the Marburg virus outbreak that's happening in Ghana, and from what I guess experts have said, it's similar to Ebola. And I kind of wanted to wait before reporting on this story. Unfortunately, if you don't, everyone knows for the most part what happened with Ebola, the Ebola crisis that happened in West Africa, and how deadly it is. And it's just a mess, and it's just unfortunate to hear now there's something similar to that going on. So I just want to kind of read this article, kind of inform people about what's actually going on, what you should expect. I've already started hearing some conspiracy theories out there, and I'm not the one to really jump on conspiracy theories, but I do have an open mind to what can happen and what has happened in the past. I'm aware of a lot that has happened to a lot of African countries, but nonetheless, I just wanted to share this story with you all, and maybe you could get some uh, some information that's actually the confirmation of positive samples from two men in southern Ghana that were tested in a lab in Senegal. So southern Ghana, thinking around Accra probably. Both men were not related, died in late June after seeking treatment at the same hospital. According to WHO, at least 90 people have been deemed suspected contacts and are in quarantine. The first patient, a 26-year-old man, died one day after checking into the hospital on June 26th. The other, a 51-year-old man, died June 28th, the same day he checked in. The men showed symptoms of diarrhea, fever, nausea, and vomiting. The WHO said the outbreak comes a little less than a year after neighboring Guinea confirmed its own outbreak, which featured a single case and was declared over in September 2021. So, okay. So I didn't know Guinea already had their own. Hopefully that's taken care of. What are the symptoms? The Marburg pathogen is one of the most dangerous known to virologists. It can infect and destroy blood, liver, and skin cells, allowing it to spread very quickly and extensively in the body. After an incubation period of 5 to 10 days, patients usually show signs of fever, headache, and muscle pain, as well as bleeding in the skin and mucous membranes. The mouth, eyes, gastrointestinal tract, and internal organs are also often affected. Symptoms of neurological paralysis are observed in severe cases, as well as a state called hemorrhagic shock, which can lead to organ and circulatory failure. Without intensive medical care, most of those infected die. Um, and this is a Ebola victim. The pictures of a Ebola victim in Congo. If you're not outside the body, the virus does not last long, making airborne droplet infections rare. Is there a vaccine? Vaccines against Marburg virus have not yet been approved by regulators, but they do already exist. Stephen Becker, director of the Institute of Virology at the University of Marburg, told DW it's actually not difficult to develop vaccines against Marburg virus, and there are already vaccines that work very well in animal models. But the clinical studies required for approval has so far been lacking. Hmm. Lacking by who? Just curious about that. Unlike with outbreaks such as COVID-19, there's a lack of political will and economic incentive to produce a vaccine. Oh, okay. Well, more information there. It's exactly the same situation as with Ebola in 2013. Becker said we got together with many others at the time and carried out phase 1 studies relatively quickly, which then were completed by phase 2 and phase 3 studies in West Africa. The vaccine was very good, and the pharmaceutical company Merck then produced many hundreds of thousands of doses for an outbreak of the Ebola virus in the Congo. This vaccine has since been approved. There's also a very similar vaccine against the Marburg virus that is possibly even better than the one against the Ebola virus, Becker said. In monkeys, the vaccine was even effective after infection, so it works as a kind of therapeutic vaccination. Once the necessary clinical trials have been completed and the required obtained, a vaccine could be produced quickly, Becker said. Since the Marburg virus and Ebola virus are similar, Becker said that the development of a combination vaccine is possible. Yeah, that would make sense. Um, how's the Marburg virus treated? Infected people often have to be treated in isolated intensive care units due to high risk of transmission. So far, however, doctors can only treat the symptoms via infusions to prevent fluid loss, electrolytes to replace blood salts, and glucose to regulate the sugar balance. Other medications can stabilize blood pressure, reduce fever, or stop diarrhea or vomiting. In event of heavy bleeding, the patient is given blood and coagulation factors. Becker also said the drugs known for their association with COVID-19 could be used to treat Marburg virus. One example, he said, remdesivir, which was originally developed to treat Ebola. How common is this? With the exception of in the central German cities of Marburg and Frankfurt, and the Serbian capital Belgrade in 1967, the Marburg virus has solely occurred in isolated cases or small epidemics in sub-Saharan African countries such as Angola, the Congo, South Sudan, Gabon, Uganda. Health authorities have responded swiftly, getting a head start preparing for the possible outbreak. Where does where does it come from? Named after a small German town in Marburg, where it was first detected in 1967, several laboratory employees in Marburg, Frankfurt, and Belgrade, Serbia, were simultaneously infected with the virus from a monkey imported from Uganda. Fruit bats likely serve as a natural reservoir for the Marburg virus, which is transmitted to monkeys or humans through contact with the animal or their bodily fluids. Eating infected wild animals can also lead to infection. Why everything coming from bats? And yeah, that's it. So that's what's going on right now. Unfortunately, people having to deal with another medical situation. You already know, after COVID-19, and of course Ebola. I think it just goes without saying, especially these tropical areas, especially West Africa, really need to develop their healthcare system. Because I can only wonder, what if those two people that was infected were treated in another hospital that was more, had the facilities to manage a lot of cases that come through the hospitals. Like we can only imagine. But I think in my personal opinion, I think a worldview that a lot of these West African countries should have is being leaders when it comes to vaccines, because a lot, just being in a tropical area, viruses are plenty, bacteria and all the other stuff that's around there. I think if one of these countries just focus on, hey, look, we're just going to focus on, vaccines, so that if there's ever any type of outbreak, we're on top of it. We don't have to wait for the WHO. We don't have to wait for political will. We don't have to wait for finance, or, it's they're already on it. That's what they're known for. I would like to see something like that, but this is the situation it is right now. It's always best to, for people just to not panic. I'm sure there's going to be a lot of reports just blowing things out of the air and just saying, okay, the whole West Africa or the whole Africa has the Marburg and everyone is dying. I'm sure there's going to be someone that does something like that, but this is what it is. This is what's going on, and hopefully this was helpful to you all that was curious about what's going on in Ghana right now. So if you like this video, if it was helpful, then definitely like it, share it with someone else that you think might find it helpful, and subscribe to the channel if you appreciate this content that I'm giving to you. So until the next video, take care.